are talking today about integrated care models, meeting youth's holistic needs. And this is Dr. Diaz and I's learning session. So thank you so much for being here. Next. Today, we're just going to be talking about some background on integrated care. We're going to touch on the Mount Sinai Adolescent Healthcare Center. We're going to hear from some patients and learn about their experiences, how they feel about that healthcare center. And then we have some time for an open Q&A as well as discussion. Next. So what is an integrated care model? When we're talking about integrated care, we're referring to something that is comprehensive, evidence-based, and an interdisciplinary approach to like patient-centered healthcare and well-being. And it essentially brings together different healthcare professionals from their respective specialties, and they're all involved in this patient care. And so that from the patient perspective, the services are intentional, consistent, and coordinated. Rather than care being siloed and like fragmented, integrated care models really look to address like patient concerns comprehensively and reduce this individualized, like fragmented care where folks have to seek this out individually. Some examples include primary, sexual and reproductive, and mental health care, among others, as well as nutrition and fitness and well-being. This care model has origins that, believe it or not, is honestly fairly young. This all started back in 1945 at the end of like World War II, successes of implementing a team-based approach to healing by using medical and surgical teams during this war. In the US, Dr. Martin Cherkassky at Montefiore Hospital, actually in New York, another reason to be a proud New Yorker, is generally credited with the concept of using interdisciplinary care teams for primary care, with his aim being to provide home care services to patients in the local community. And this program was established in 1948. The history on this is really interesting, honestly, and it can be its own standalone learning session, but just due to time constraints, I'll leave out some other details. But if you are all curious, I definitely suggest following up and digging in deeper because the history is absolutely very rich. So you can dig into Dr. Cherkassky's history along with Dr. Richard Cabot and Ida Cannon, who really helped like pioneer and set the foundation for this field and wrote a lot on the teamwork of the doctor, the educator, and like social worker. As I conducted some research, I found that this care model has led to positive outcomes in patients, and with some being like higher rates of depression screening, higher adherence to diabetes care, lower rates of like overall healthcare utilization for like emergency room visits, as well as like lower costs. Due to having to go through to several different healthcare spaces, something that I'm sure like many of us can relate to. I know when I need to make an appointment, one of the barriers to entry is having to set it up and having to like navigate all of these like unfamiliar systems and figuring out like, is my insurance accepted here? If it is, like, do I have a copay? If it is, how much? And so an integrated care model really helps like ameliorate a lot of those questions. Some additional benefits in this care model include like patient satisfaction. Patients benefit from the enhanced collaboration that's afforded through this care delivery model, as well as the benefit of having a centralized space and care team that they would otherwise need to establish in an individual setting. Quality of life. Various practitioners can collaborate with one another closely, and they get to address the unique needs of that one patient holistically and create a customized and personalized treatment plan to enhance and manage their health concerns, ensuring that they're receiving that appropriate treatment and overall improved well-being. There's also an increased access to service. Patients who need mental health services, for example, can quickly get a referral from their primary care physician and see a counselor who's within that same organization and sometimes even in that same building. And lastly, cost. There's a lower overall cost of this kind of healthcare. The enhanced information sharing in an integrated care model may also speed up diagnosis and help eliminate the redundant medical tests and exams, which further reduce the cost for both the patients and the healthcare companies alike. I know from my experience, I've had to go to seek therapy outside of my space. And so I would have to further have these conversations that I already had with my primary care physician and gain that support from an outside provider, even though like my primary care physician is also a prescriber, and that also add an additional burden of care. They're oftentimes like serviced by folks that have the personal stake in the communities that they serve. And this has the potential to inform more positive health behaviors as these providers are able to speak to the nuances and directly implement and support the community that they serve, because they can speak to those specific health behaviors, in addition to facilitating that welcoming environment for patients that are already familiar with a specific facility and the way that it works and runs. Next. Sorry.
Go ahead.
Oh no, I was just going to introduce you. This is the Mount Sinai Adolescent Healthcare Center, and they have an integrated barrier-free services for youth.
Thank you, Joey. So you heard from Joey all the benefits of an integrated model and also the amazing outcome and cost effectiveness. So the Mount Sinai Adolescent Health Center is an example of such a model. It was created in 1968. And this program serves young people ages 10 to 26. And at any moment, we have about 38,000 patients and serve more than 12,000 of them per year. Next. We are really integrated. We are lumpers, basically. We integrate our work within the community, like we train youth leaders who become peer health educator, and then they work in many, many sites in the community and schools. We go to colleges and we do pregnancy prevention work. We provide health services on site at colleges and have full-time clinics inside 6 high school buildings. And through those, we serve 23 high school and middle schools. And our big center, even though it's part of Mount Sinai Health System, is really run and seen as a community health center. In addition to that, we integrate services, training, and research. We also integrate advocacy and policy with the services, training, and research. So everything with us is integrated, and we can get into this during our discussion. In addition to that, the services themselves that the individual patients get is integrated. So we have an integrated model of medical care, sex and reproductive health, dental, optical, health education, behavior and mental health. And I often say from head to toes, from dental to mental. So it's really integrated. We also have nutrition and fitness services. We have mind-body work like yoga. We have academic support like tutoring, SAT prep. We help the youth with college entrance application. And we also do healing through the arts, like self-expression, like through photography or creative writing. So it's a really broad definition of health, and take basically every element of the person into account. We serve the general youth population, but most of our youth are low income. 94% are Black and brown, but within that, there's tremendous diversity, including we work with young people with history of trauma, childhood sexual abuse, rape, sex trafficking. We work with young people who are homeless, who are in foster care, who are immigrants. We work with young people who are refugees. So we really, the beauty of this program is that somehow the young person feels very comfortable coming to our door. You know, LGBTQ, we have a huge transgender program where we give the young people the hormones and help them transition. So I just love that. And we call it an adolescent health center, so it doesn't have stigma. So we don't call it a family planning clinic or a mental health clinic or, you know, whatever. But young people come, no one knows what they are coming. They sit next to each other, and only behind closed doors, the clinicians, the provider know what is it that a young person needs, and we work on that. We have 15 different, 15 different disciplines working together around the one young person. And some of them may need 2 or 3, some may need like all of them, including legal services. Our kids have complex lives, and we want to be able to provide for them as much as possible under one roof. All those services are provided at no cost to the young person. They don't have to have health insurance. We don't exchange a single penny, even if the person has money. We just feel that young people have the right to be served. And if they come to us, we want to be here for them. We pay for all the laboratory tests. If they need a CT scan, they get a CT scan. We pay for their medications, and we give them Metro cards for transportation. So we really aspire to have a program without barriers. Next. This is just to give you a sense of the space. So we have areas that we call the green area or the yellow area. We also have red and blue. And we do that to make it easier for the young person to know where to go, to identify a large space. Also, all the arts that you see in the walls are made by young people. We actually either buy them camera and bring professional photographers to help them learn the skill of photography. And also then we use those images to learn about them, and then we do an opening, and it's their place. So everything here belongs to them, and that is their art, and they are really, really creative young people. Next. This is one of our physicians, Dr. Stever, with one of our young people. And you see, I mean, the energy is so positive. Sometimes you think clinic and it's like boring, dark. We are just we love the youth. And Dr. Stever is an adolescent medicine physician like I am. We have the same training. And he also he's the lead, the most experts of all of us in working with HIV positive youth and also the transgender youth. I mean, we all do different, whatever we need to do, but he's the most experts on those particular issues. Next. This is Marisela, who's a medical assistant. And you see the young person, again, you know, just very happy. Though the place is very simple. We have what we need to do the head-to-toe work that we need to do. Next. I mentioned to you that we do mind-body work. So these are young people doing yoga. And this particular room is, we call it a gym, but it's just a large space. And the floor is for dancing. So the youth also dance, Zumba, hip hop, you know, they exercise. That's where we do the physical fitness work. And if not, we also take them we pay the Y and take our youth there to work with people who have expertise in sports and exercise. And so we know how important physical activity is for young people, and they cannot always able to get that in their neighborhood, either because they feel they're not there, period, or they don't feel safe, or they don't have the money to pay. So we try to create for them those things that we think are really will be great, will enhance their health and their well-being as people, not just as patients. We actually consider them young people. Next. This is a map. I mean, if you know New York City, this is a map of New York City, where you see that little blue cross is where our program is. All the black, we are in Manhattan, the physical location. All the black dots that you see around are patients. So they come from all over the 5 boroughs of New York City. They also come from New Jersey here on this side. They come from also Pennsylvania, DC, Connecticut. So they come from other states. They could come from California. If they are 10 to 26, they come through our door. We see them. They can get off the plane in Kennedy Airport and get to our door from Africa or Asia, from whatever. If they are 10 to 26, we serve them that same day. So it's really, we just want to serve young people and be there for them whenever they need us, for whatever they need us, and we partner with them. So I would like for you to hear directly from the young people that we work with, 4 of them, as to why they come here. What is it that they get from the way that we work? Not just the services that we provide, but also there's like a magic. There's a way of approaching them. There's a belief, there's a philosophy. Next. So this is a story of a young woman that presented very young at one of our school-based clinics with depression. Go ahead.
I came to the center exactly 5 years ago. I was 17. I was going through quite a depressive relapse at the moment, and I was self-harming for quite a few years. And by the time I turned 17, I felt like I didn't want to keep living my life that way. I kept thinking, you know, I can't make it through another night like this, and I decided to take a step forward. I've seen my social worker, Lily Divino, for those 5 years, and the way that things have changed has been tremendous. I honestly don't think I would be here if it wasn't for that. I would not have stopped self-medicating. I would not have stopped cutting if it wasn't for the help and the support that's given to me here every week, without question. You come here and the first thing that they will tell you, you know, is this is between us, this whatever is said is here between us two, and that's such an important part. After I came out, my family situation was very difficult. When I mentioned it to Lily, she suggested coming for family therapy. My parents got to know Lily. You know, she's a household name now. We all know who she is by first name basis. My mother has her number. That's how connected we became. I think the best way to describe the center for me and what it's like to be part of the center is very safe, very empowering, you know, and very supportive more than anything. From the moment you come in through the doors, you know, every single person in that building has been so sweet to me. This place has shown me what it feels like to have hope and to have a safe haven and to feel like I'm not alone. And for that, I'll be eternally grateful.
Next.
It's not as nerve-wracking, like there's not a bunch of people. It was very quiet, and when you go to the front desk, there's not a lady like, what do you want? She was like, oh my god, hi, how was your day? And I was like, oh, you care, okay. So it was comforting. When they called my name, I just went straight to the back where the doctors were. They took my blood pressure and everything. Even the nurses were nice. And it's good that they like their jobs because you could feel that vibe. From anybody, you could feel that vibe. It was very comforting, and I got shots. That was awful, but with a smile on their face, it made it a little better. I was with the doctor in the room, and I saw a counselor after because I got an HIV test also, and they have a counselor for that. And I thought that was awesome that they asked me, you know, questions about my personal life so they could see where my mind is at, even if the test was to come out positive, like where my mind would be. And I don't think I saw that in any hospital before. Everything that the clinic has to offer, the counseling that they would give you if you have a problem, the physical that they can give you for free, the dental that they can give you for free, the obstacle place that they can give you for free, stuff like that is hundreds of dollars that your parents would have to pay for. And even if you want to come to the clinic and don't want to tell your parents, it's confidential, and I think that's the safest way to get somebody to be open about themselves and be comfortable. I saw a doctor. They did all my checkups, my physical. By less than 2 hours, I was out in the street already, back doing whatever I had to do for the rest of the day.
Yeah, go to number 2. You skip number 2. The second video.
regularly donated blood, and there was actually a mobile blood bank that was coming by my school at the time, and I donated blood. A couple weeks passed, and then I actually got a letter in the mail saying that I had to go to the blood bank in Midtown because they had to tell me something about my blood. It was pretty obvious what it was, honestly, when I received the letter, but I went anyway, and then they told me the news that I was HIV positive, and they gave me a list of possible hospitals with programs that could help me kind of do what I had to do as far as HIV was concerned. I actually went to the Adolescent Health Center because I saw that it was tied to Mount Sinai, and on top of that, it was actually as furthest away from Queens as I could possibly get, which is where I'm really from. I was still kind of unsure what HIV was, so I didn't want to bump into anyone that I potentially knew or anything like that. Honestly, the first time I was there was kind of intimidating. I couldn't even bring myself to say HIV. It was something that was just, the words didn't even want to escape my mouth. Just seeing how I was treated by Dr. Francis, Tara, Maya, a level of comfortability developed. I think mentally I was kind of all over the place. I wasn't out, I didn't really have any direction. I felt lost, for lack of a better word. What the AHC helped me with was direction, honestly, not only with being positive, but this direction in everything in my life. They didn't let me get away with just good enough. I graduated cum laude 3 years from a reputable school, and now I'm in grad school. I have a great job, and this is thanks to them, because easily if I fall into, I feel, a bigger system, I would have fallen through the cracks, and yeah, I would have been on pills, but that's just about it. I wouldn't have wanted to do better for myself. Project Impact is an HIV-positive group that services teenagers up to the age of 24. It has such a wide range of people. You'll have someone who's 14 just dealing with high school things, and then you'll have someone who's 20 currently having issues with housing. I could think of one example, someone who I do know in Project Impact, HIV positive, thanks to Hausa, ended up being able to get a place by himself, live comfortably, get a job, and just lead a normal life. And if it wasn't for Project Impact putting him into touch with Hausa and programs of the sort, he would probably still be homeless. That's what Project Impact offers people who are HIV positive and under 24, honestly, just direction when there is none. After getting my MBA in marketing, I'm actually looking forward to potentially working for a pharmaceutical company that develops HIV drugs and kind of just continuing being part of this, you know? I don't want to just become someone who happens to have HIV. I want to be an advocate for it. I want to show people the same way the AHC showed me that that's not a hindrance. If anything, it's a tool to your advantage.
Then the last video is a patient in our young parents program, teen parent program.
There was a time in my life where I was facing something like domestic violence, and I like keeping my personal stuff personal. So I came in and Julie noticed I was kind of sad. She asked, "Is everything okay at home?" And I told her, "Yeah, everything's okay." But she already knew who I was, and she knows I'm a happy person all the time. And she says, "I don't think everything's okay, but are you sure everything's okay?" So I just I trusted her, and I vented out. I told her everything, what was going on at home, and she referred me to Trisha, and I spoke my heart out to Trisha, and she helped me so much.
We worked on trying to make home safer and trying to figure out what steps she needed to take in order to make sure that she and her child were safe.
She made me feel the comfort that I needed to have at the moment, and she made me feel that everything was going to be okay. And ever since that day, I've been so thankful with Trisha.
I work in the mental health clinic and in our teen parent program. And in the teen parent program, I work with moms of all ages.
He loves his iPad, and I didn't know how to get him off of that. So with Trisha, she taught him how to color and all those things, and now he loves coloring. Every time we go to Target, he wants a box of crayons. So that's good.
Often we'll get teenagers who have gone to other clinics where they have felt shamed for being a parent. I'm horrified to think of what that must be like for them. So here we try to just celebrate them being mothers, celebrate the joys of watching their children grow and develop.
It was a best decision to come to this clinic because I feel like there's no other clinic like this. And every time I talk to my friends about this clinic and I tell them, hey, it's a great clinic, and you know, this social worker Trisha helps me out through any situation that I have at home, school, my job, anything. If they ever do think about stepping in here, they won't regret it. It'll be a great decision.
And the last slide just has my information. So, you know, basically, this program is about, we are around since 1968. So we're around for a very long time. And it's about, from the very beginning, it's about the young people and helping them really achieve equity and health equity. And really our frame is about racial, social, economic, and sexual and reproductive justice. So we really want to clean things for the young people to be able to be successful, to have the full lives that they deserve. And that's what we do. And we love to engage in conversation with you now.